Hi, my name is Amy, and this is my NG tube insertion video. So to start off with, I'm going to verify the provider's orders and head to the patient's room, close the door, introduce myself. My name is Amy. I'm going to be doing your NG tube insertion, and can I get your name and date of birth? So 2 identifiers. Once we have that, we're going to go ahead and make sure we have our supplies, which is a cup of water, warm basin, gloves, hand hygiene, a pen light, a 60cc syringe, the nasogastric tube, a suction canister if needed, also a pH test strip, and a safety pin or elastic to attach the tubing to the gown. And we'll go ahead and start our hand hygiene and put on our gloves, and we're gonna start with the inspection of the nose, just to make sure there's no occlusions, abrasions, and that we can get the tube into the patient's nose. So we're going to go ahead and have them sit in a high Fowler's position, and we're going to start with them tilting their head back and taking a look into their nose. Like I said, watching for abrasions or deviations. Okay, and then have them do a flare test to see which nostril flares the most, and in this case we're going to do the left. So we'll start off with preparing tape, which I already did right here. And I'm going to go ahead and split one of those tapes in half too. And we'll take the tubing and put it in a warm basin of water to let it warm up and soften. And go ahead and measure. So we're going to go around, down the ear, and down to the xiphoid process, and we'll mark where it kind of lands, which I already did with a little bit of piece of tape right there. And we'll just stick this back in to the warm water basin where we get the patient ready. So we'll put like cloth down underneath them so they don't get water anywhere, and go ahead and get the tubing into the lubricant, which I seem to have misplaced. Right here. Okay, into the lubricant. And from here, we're going to go ahead and have them tilt back just a little bit, and we're going to go ahead and insert the tubing into the nose and shoot down the nasopharynx. Okay, and if there's any resistance, then pull it back out, do more lube, and kind of try it again. So from here, we're going to go ahead and push back and down. And once it gets to the oropharynx, they may have some gagging just because the reflux is right there. So that's when we want to bring in the cup of water and have them swallow as we continue to insert the tube 5 to 10 centimeters at a time. So we'll just have them keep going and then have them keep drinking. So keep drinking, opening your throat, keep drinking so they can get kind of past that. And then keep drinking. You're doing great. Keep going, keep going. Keep going, keep going, keep going. Make sure they're doing okay. If they need a second, definitely just stop. Let them catch their breath. Breathe a second and then keep going. Okay, and then once we're at that piece of tape, we're gonna just stop right there and go ahead and grab another piece of tape, and we're just gonna tape it into place a little bit just until we're able to make sure it's in the correct location. So I'm gonna go ahead and just tape that to hold on to the tubing just until we can confirm everything. Okay, and from here we're gonna go ahead and attach this on. Oops, I didn't touch the wrong section here. Okay, yep, we'll get that all attached on. And we'll start off with pushing 20 to 5 cc's to make sure we can hear some bubbling that's in the stomach or gurgling. So we'll go ahead and do that and listen with our stethoscope as we push it. Okay, and we get our gurgling, which is good. We're also gonna withdraw some of the gastric juices. And we'll just do 5 to 20 cc's like we kind of did with the air. And we'll take that off. And go ahead and place that on the test strip and make sure the pH is lower than 5. That means we're in the stomach. Okay, and if that's also good, we can also verify with a chest X-ray just to make sure we're in the right location. And if the patient's doing well, we can go ahead and further attach our tubing. So just make sure that's plugged and not going to go anywhere. And we'll just take this on and watch the skin integrity with the bandage. So I'm just going to wrap this one here and go ahead and wrap this one around so it's pretty well in place. Take just this extra little piece off. Okay. And we'll also just wrap this and attach it to the patient's gown so this doesn't get pulled. And we can do that with the elastic or the safety pin. And then we'll come up with make sure we have our plan in place on making sure we're pushing fluid to keep the tubing clear. Also verifying between each meals that it's in the right location. So most likely the patient will eat 4 times a day with like a bolus. And we'll just push that in over a couple minutes to make sure everything's going fine. And otherwise, we'll go ahead and remove our gloves, perform our hand hygiene, and document our feeding plan, our procedure we did, and the verification of where the tube was placed, and make sure everything is all good and dandy. Awesome. Well, that was my video. Thank you.